Hello guys. Um, so today I am going to just study about the this pharmacology and pathology, and yeah, let's begin. One sec, guys. Just a sec. First, we will do the this pharmacology. Then we will do the pathology. Not this one. Okay. Autonomic and somatic nervous system. So autonomic sympathetic nervous system medulla accelerated so guys, in this video I will not explain you anything. Just I will read the topics and yeah, that's it. And actually, the motive of this stream is to not teach you something, but to um, just read and understand and understand the topics. Okay, guys. So autonomy, somatic, innovation and innovation, if you try depend on affinity. Adrenaline blockers, the adrenergic antagonist, also called the adrenaline blockers or sympathetic agents, bind to the adrenaline but do not trigger the using numerous adrenergic antagonists have important roles in medicine, primarily to treat diseases associated with the nervous system. So, adrenaline block antagonist, alpha blockers and beta blockers. Alpha blockers, we have non-selective and alpha-selective. Non-selective phenoxybenzamine, irreversible pendolamine, and tolazoline and nicergoline, Sermion. Alpha blocker, alpha 1 selective, we have the prazosin, doxorubicin, terazosin, tamsulosin, omni. Adrenal antagonist, beta blockers, we have non-selective and beta 1 selective. Non-selective in we have the propranolol, sotalol, timolol, pindolol, nadolol, and oxprenolol. And in beta 1 selective, we have atenolol, nebivolol, bisoprolol, esmolol, metoprolol, acebutolol, and talinolol. Okay. So these groups are further subdivided into non-selective alpha blockers that block alpha 1, both alpha 1 and alpha 2 adrenoceptors. Example is the phenoxybenzamine and phentolamine, and selective alpha 1 blocker, prazosin and others. Non-selective beta blockers which block both beta 1 and beta 2 adrenoceptors, and beta 1 selective blockers. All of these agents are pharmacologic antagonists or partial agonists. Example is the pendolol. So pharmacologic effects of alpha blocker, vasodilation, all of this agent decrease the peripheral vascular resistance and lower arterial blood pressure by causing the relaxation of both arterial and venous smooth muscle. Second, relaxation of urinary bladder sphincter decrease the risk of atherosclerosis. Adrenoceptor antagonists, alpha blockers, decrease arterial and venous tone, decrease peripheral resistance, hypotension, reverse the pressure effects of epinephrine because it's beta 2 mediated vasodilator effects are unopposed by alpha mediated vasoconstriction, peripheral resistance falls, epinephrine reversal. Cause reflex tachycardia. This is greater with non-selective drugs that also block alpha-2 presensory receptors on heart because the augmented release of norepinephrine further stimulates the cardiac beta receptor as well prazosin. So non-selective alpha blocker, phentolamine and phenoxybenzamine, and subclass phentolamine and okay. These two are the alpha non-selective. It means that they can block alpha one as well as alpha two receptors. Phentolamine competitive pharmacologic antagonism at alpha receptors. Being pheochromocytoma, which means the tumor of adrenal gland, and the massive release of norepinephrine and epinephrine, which are called as catecholamine, and which are the important hormones in the body, which trigger the fight, flight, and fight response. Pharmacokinetic IV intravenous oral duration 2 to 4 hours, and toxicities interactions orthostatic hypotension refresh tachycardia. Okay. Phenoxybenzamine irreversible covalent binding to alpha receptors. First is the pheochromocytoma. Second is the carcinoid because of a serotonin blocking effects, and mastocytosis because of H1 antihistaminic effect. Oral duration of action 24 to 48 hours. Orthostatic hypotension, reflex tachycardia, and gut irritation and nausea. Note: phenoxybenzamine is contraindicated in patients with a decreased coronary perfusion. Pheochromocytoma, a tumor adrenal medulla consisting of cells that release varying amounts of norepinephrine and epinephrine into the circulation. Such patients may have severe hypertension. Yeah. Alpha-1 selective blockers are prazosin, doxazosin, terazosin, tamsulosin, alfuzosin. Note: the name of drugs from this group can be remembered by the aid of suffix zosin. Yeah, prazosin, competitive pharmacologic antagonism at alpha-1 receptors. Hypertension, benign prostatic hyperplasia, for prevention of urinary retention, oral duration 8 hours, orthostatic hypertension, especially first dose, but little reflex tachycardia. Okay, so this is a like alpha one selective agonist. ठीक है. Clinical use of alpha blocker: overdose with drugs of abuse like amphetamine and cocaine. They may lead to severe hypertension because of the indirect symptomatic actions. This hypertension usually responsible to alpha blockers. Sudden cessation of a clonidine therapy leads to a rebound hypertension. This phenomenon is often treated with phentolamine. Pheochromocytoma, phenoxybenzamine. Okay. So in the overdose of the drug is like cocaine and amphetamine. This alpha blockers are used, especially the alpha one selective blockers. And in the sudden cessation of clonidine therapy, it causes a rebound hypertension. Actually, this clonidine, I have explained in this in my previous video that the that this clonidine is a alpha 2 selective agonist. Okay, so what is the function of alpha 2 receptors? It actually decreases the release of norepinephrine and epinephrine into the synaptic left, therefore reducing the BP. Okay, so when this clonidine stopped, so it causes a rebound hypertension. Why? Because yeah. So this one is often pheochromocytoma. Phenoxymazine is used in treatment of pheochromocytoma, or reticulocyte secreting tumor of cells derived from the adrenal gland. Prior to surgical removal of the tumor, patients are treated with phenoxybenzamine preclude the hypertensive crisis that can result from manipulation of tissue. This drug is also useful in chronic management of these tumors, particularly when the catecholamine secreting cells are diffuse and therefore inoperable. Hypertension and hypertensive crisis, heart failure, pulmonary edema, blockade of alpha receptor reduces peripheral resistance and consequently reduces cardiac afterload. Prostatic adenoma, tamsulosin oblique as a symptomatic therapy. Acute and chronic cerebral metabolic disorders, niacin or sermion. Because of vasodilation effect, phenoxybenzamine is often in treating the uh, renal disease, frostbite, and acrocyanosis. Repeat. Phentermine यूज किया था in the cessation of chemotherapy. ठीक है. फियोक्रोमोसाइटोमा के लिए फेनोक्सिबेंजामाइन. ठीक है. और फेनोक्सिबेंजामाइन in treating the renal disease, frostbite, and acrocyanosis. ठीक है. Irritable dysfunction के लिए phentermine plus पापा पापा वेरिनियम. Locally selective alpha 2 blocker. ठीक है. So phentermine is now rarely used for treatment of impotence. It can be injected intravenously. Phentermine is also used to prevent locally to prevent dermal necrosis. Ah, okay. See, she also due to no application. Yeah. Mm. She side effects. Orthostatic hypertension that is most marked in the upright position caused by veins pulling typical of alpha blockade or inadequate blood volume caused by blood loss or excessive diuresis. Rhinitis ehuresis. Orthostatic means like the person he's sitting and he immediately stands up, so he faints because the BP drop below normal and this causes the blood to blood yeah, re- re- reduced blood flow to the blood to the brain and therefore causing the hypoxia and syncope of the person. Gee. The first dose of these drugs produces an orthostatic hypotensive response that can result in syncope fainting. This action, termed as a first dose effect, may be minimized by adjusting the first dose to one third or one fourth of the normal dose and by giving the drug at bedtime. बीटा ब्लॉकर नाउ अल्फा ब्लॉकर के अंदर क्या था अल्फा वन ब्लॉकर सिलेक्टिव अल्फा वन ब्लॉकर जो थे उनका लास्ट लास्ट क्या था ओसिन था प्राइजोसिन टैमसिलोसिन डोक्साजोसिन एंड या अल्फोजोसिन ठीक है एंड अल्फा नॉन सिलेक्टिव क्या थे फेंट्रलमाइन और फिनोक्सिबेंजामाइन ठीक है phenoxymethyl is this binds covalently to the receptor, so it can be reversed back. Okay, okay. Beta blocker drugs. Note the names of all beta blockers ending olol, olol, lolol. All of the beta blockers used clinically are competitive. They are competitive pharmacology antagonists. Competitive. Non-selective beta blockers act at both beta one and beta 2 receptor, whereas cardioselective beta antagonists primarily block beta 1 receptor. ठीक है. There are no clinically useful beta 2 antagonists. ठीक है. Although all beta blockers lower BP in hypertension, but they do not induce posterior hypertension because alpha adrenergic labetalol, carvedilol, and bupindolol block both alpha and beta receptors. Okay. जी. Adrenoceptor antagonists, beta blockers. They vary in lipid solubility and cardio selectivity. All block beta 1 receptor and decrease BP and prevent angina. Okay. Hierarchy OW drug more rapid absorption from GIT, forces hepatic elimination more rapidly eliminated. Also more likely to enter CNS and cause the central effect abdominal nightmares. G. Cardio selectivity diminishes with higher doses. ठीक है. Nevertheless, selective beta one blockade less peripheral because beta one this beta one receptor receptor allocated in only in heart. Yeah, and less peripheral vasoconstriction, cold hands and feet, and does not reduce the response to exercise-induced hypoglycemia. Stimulation of gluconeogenesis in liver is mediated by beta 2 receptors. ठीक है. Cardiac-selective drugs may have sufficient beta 2 activity to, to present severe bronchospasm in patients with asthma. These patients should avoid beta blockers. ठीक है. Some possess intrinsic symptomatic activity, partial agonism, but this is debatable. ठीक है. So classification of beta blockers. So we have non-selective beta 1 blocker, beta 1 and beta 2 blockers. Pure blockers are sotalol, humulol, and nadolol. With membrane stabilizing activity, I may say propranolol. With intrinsic sympathetic activity, I say pindolol, cardiolol, and penputalol. With ISA and MSA, oxprenolol. Cardiac beta blockers, we have pure blockers, atenolol, bisoprolol, esmolol, with membrane stabilizing activity, metoprolol, tolamolol, with intrinsic sympathomimetic activity, Practolol, yeah, celiprolol, and with ISA and MSA, acebutolol. Drug that block both alpha and beta receptor, labetalol, carvedilol, and bupindolol. Yeah. So, we have two types of beta blockers. First is the beta 1 selective, which we also call it the cardio selective beta 1 blockers, and we have the beta 1 as well as and the beta 2 receiver blockers. So in the case of this non-selective beta 1 blockers, we have the pure blockers 3, sotalol, timolol, and the nadolol with membrane activity propranolol with intrinsic sympathetic activity ISA, pindolol, cardiolol, and penputalol with ISA and MSA, oxprenolol. Cardiac beta blockers, pure blockers, artenolol, bisoprolol, and esmolol. With membrane stabilizing activity, metoprolol and the tolamolol. With intrinsic sympathetic activity, Practolol and celiprolol. With ISA and MSA, acebutolol and drugs that block both alpha and beta receptors, labetalol, carvedilol, and the bupindolol. Okay. Beta adrenoceptor blockers for pharmacokinetic properties. water solubility, lipid soluble, we have the propranolol, timolol, metoprolol, and the penbutalol. Water soluble, we have the nadolol, atenolol, and the acebutolol. The duration of action: ultra short acting esmolol, intermediate acting PTPM. Wait, एक मिनट अब इंचो अरे सिंपल है यार देख लिपिड सोल्यूबल जो है वो इंटरमीडिएट एक्टिंग है सब प्रोपेनॉल टिमोलॉल पिंडोल नहीं है पिंडोल ठीक ठीक ओके ओके भाई ठीक है सो ओके सो अल्ट्रा शॉर्ट एक्टिंग एस्मोलॉल 9 9 9 मिनट हाफ लाइफ इंटरमीडिएट एक्टिंग प्रोपेनॉल टिमोलॉल पिंडोलॉल मेटोप्रोलॉल ठीक है ठीक ये तीन तो सेम है लिपिड सोल्यूबल वी हैव द प्रोप्रानोलॉल ट्यूमुलर एंड मेटोप्रोलॉल इसके अंदर भी क्या है प्रोप्रानोलॉल प्रोप्रानोलॉल ट्यूमुलर एंड द पीटीएम पीटीएम हाँ पेरेंट टीचर मीटिंग propranolol ट्यूमुलर and the metabolite lipid soluble as well as they are the intermediate PTM propranolol tumoral and the metabolite long acting we have the nadolol, atenolol, and the bisoprolol. Okay. Pharmacology effect CVS. CVS means cardiovascular system, respiratory system, kidney, metabolic effects, CNS, peripheral nervous system, eye, ankle, jaw. So if it and clinical uses, the clinical application beta blockade and are remarkably broad. Hypertension, reduce cardiac output, reduce renin secretion. Labetalol and carvedilol, what are these? These are the both alpha and beta blockers. Yeah. They contrast with the other beta blockers that produce peripheral vasoconstriction. Yeah. And these agents are therefore useful in treating the hypertensive patient for whom increased peripheral vascular is undesirable. Yeah. Remember, in general, black hypertensive patients are not well controlled with the beta blockers. Why? Intravenous labetalol is used to treat the hypertensive emergency because it can rapidly lower BP and has a short duration. Okay. Angina pectoris reduce cardiac rate and force. Cardiac output, work and oxygen consumption are decreased by a blockade of beta 1 receptor, and these effects are useful in the treatment of angina, cardio protective effects. Yeah. Arrhythmia prophylaxis after myocardial infarction. Reduce automaticity of all cardiac pacemakers. Beta blockers have a protective effect on myocardium. Thus, patients who have had one myocardial infarction appear to be protected against a second heart attack by prophylactic use of beta blocker. ओके तो जिन जिन तो जिनको पहले हार्ट अटैक हुआ है उनको जो है अपन देते हैं स्टार्टिंग में बीटा ब्लॉकर प्रोफेलेटिव मतलब ये in addition administration of a beta blocker immediately following a myocardial infarction reduces infarct cells and hastens recovery. The mechanism for this event may be a blocking of action of a circulating catecholamine, which would increase the oxygen demand in an already ischemic heart muscle. Okay. Oh, also, okay. Propranolol also reduces the incidence of sudden arrhythmic death after myocardial infarction. Okay. Supraventricular tachycardia, slowed or blocked atrioventricular conduction velocity. Chronic congestive heart failure, labetalol and carvedilol decrease mortality in congestive heart failure. Why? Because these block both alpha 1 and alpha and beta receptor, namely the alpha 1 and the beta 2. So, labetalol and carvedilol they do not enter serum lipid or blood glucose levels. Carvedilol also decreases lipid peroxidation and vascular wall thickening effects and have a benefit in heart failure. The carvedilol is used to prevent cardiovascular mortality in patients. Ah, okay, bhai. ठीक है, carvedilol. Okay. Obstructive cardiomyopathy, hypertrophic subaortic stenosis, cholesterol density, aneurysm of aorta, portal hypertension, subarachnoid hemorrhage. Conditions associated with the sympathetic overactivity, acute anxiety state, panic syndrome, childhood phobias, acute porphyria, drug withdrawal syndrome, pheochromocytoma, along with alpha blockers, thyrotoxicosis, reduced cardiac rate, and arith- arrhythmogenesis, reduced conversion of T4 to T3. In acute hyperthyroidism, thyroid storm, beta blockers may be life-saving in protecting against serious cardiac arrhythmias. ठीक है. Migraine prophylaxis mechanism is not understood properly in prophylaxis. Familial tremor proper अच्छा proper बहुत important है. ठीक है. Propranolol okay no sorry. Glaucoma reduced secretion of aqueous humor. Cumulol levobunol betaxolol. It is used topically in the treatment of chronic open-angle glaucoma. However, in an acute area of glaucoma, pilocarpine is still the best glaucoma claim. The beta blockers are only used to treat this disease chronically. Characteristics: adrenergic blocking agent, Inderal propranolol non-selective. Use angina, dysarrhythmias, hypertension, migraines. Side effects many non-selective. Contraindication asthma, heart block, first degree. ठीक है. Many press Prazosin alpha blocker use mild to moderate hypertension and side effect is the also steady hypertension. And tenormin, atenolol, loperazole, metoprolol, beta 1 cardiac use mild to moderate hypertension angina. Non-selective versus selective beta blockers. So non-selective have an they have an equal inhibitory effect on beta. Drugs have lots of interaction due to lots of alpha or beta receptor sites throughout body. Use with caution on patients with cardiac failure or asthma. Selective beta 1 is helpful in asthma patients. Yeah. Hmm. ठीक. Pheochromocytoma के कौन फेंटलमाइन. रुक रुक वो सड़ी है. क्या बोल रहा तू? हक दिया यार. छी. Pheochromocytoma के लिए we use this phenoxybenzoin. phenoxybenzoin यहाँ पे कौन सा करते हैं? यहाँ पे करते हैं अपन लेबेटोलॉल. ठीक. साइड इफेक्ट्स. Adverse effects include bradycardia, atrioventricular blockade, heart failure, non-selective decrease in physical activity. Beta blockers cause peripheral vasoconstriction, reflex after hypertension, in reduced blood flow. ठीक है, 10 बीटा ब्लॉकर हाँ ठीक। और इसको इसको कौन सा ड्रग यूज करते हैं अपन? फिनोक्सीबेंजामाइन है ना? फिनोक्सीबेंजामाइन। हाँ चलो ये तो ठीक है। चलो, Phenixabenzamin it is used in the pheochromocytoma and the Raynaud disease, frostbite and acrocyanosis. ठीक है, ओके भाई। ओके भाई। साइड इफेक्ट्स हाइपोग्लाइसीमिया, elevated LDL, low density lipoprotein diminish, high density lipoprotein levels in the blood, atherogenic effect. ठीक। Bronchospasm, yeah, beta blockers cause bronchospasm can be fatal in asthmatics. Patients with airway disease may suffer severe asthma. Therefore, beta blockers, particularly non-selective ones, are contraindicated in patients with COPD or asthma. CNS adversely increase sedation, fatigue, and sleep alteration disturbance. Abscess withdrawal syndrome, abrupt withdrawal with beta blocker maintains angina, myocardial infarction and even sudden death in patients with ischemic heart disease. Therefore, the dose of these drugs must be tapered. Combination of beta blockers with anti-arrhythmic drug, verapamil and dil dil diltiazem is not prudent practice. Used simultaneously, these drugs cause cardiac blockage and asystole. Sexual dysfunction in some patients. Metabolic disturbances, hypoglycemia after insulin injection, decrease glycogenolysis plus decrease glucose excretion. Cardioselective beta blocker atenolol, nevi- nebivolol, bisoprolol are used in the diabetic hypertensive patients who are receiving insulin or oral hypoglycemia. क्या बोला? Atenolol, nebivolol, bisoprolol. Atenolol, nebi, ne, nebivolol and bisoprolol are used in the diabetic hypertensive who are receiving insulin. ठीक है, चलो भाई होगा। Alpha blocker, alpha 1 selective reactor, prazosin, doxorubicin, terazosin, tamsulosin, omni. Adrenal and